I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very popular topic that is often misunderstood, and that is the dreaded lower blepharoplasty, or what some people call a neck lift. So lower blepharoplasty is one of the most common surgeries that are performed in plastic surgery. It's a very, very popular surgery, but there are some truths about the surgery that not many people know. And it's important for you to understand those truths before you decide if this surgery is right for you. So let's get right to it. The first truth about blepharoplasty surgery is that it does not get rid of neck wrinkles. Now, when you look at someone who has a lower blepharoplasty, you will notice that their eyes look more refreshed, their upper lids often look more open. But if you look closely, the neck often looks exactly the same. In fact, sometimes after the lower lid surgery, the neck can actually look a little bit older because the skin of the lower lid, when it's removed, can sometimes accentuate the jowling or the neck laxity that's already present. So it's important to understand that blepharoplasty surgery does not address the deeper tissue of the neck. It only addresses the skin of the neck. And so if your main concern is the deeper tissue of the neck, then blepharoplasty surgery is not the right surgery for you. You may be a candidate for a facelift or a more advanced surgical technique like a high smut lift. The second truth about blepharoplasty surgery is that it cannot fix your undefined jawline. Often people have a bit of jowling or laxity of the skin along the jawline, and they think that this will be fixed with a blepharoplasty surgery. But once again, blepharoplasty surgery only addresses the skin of the lower eyelid. It doesn't address the deeper tissues. And so if you have an undefined jawline or jowling along the jawline, that will not be addressed with a blepharoplasty. You may be a candidate for a different type of surgery, such as a jaw or neck lift, to help address those issues. Now, it is possible to address some of these issues at the same time during the blepharoplasty surgery. For example, in someone who has a very, very mild case of neck laxity, I may perform what is called a mini neck lift or a limited lower blepharoplasty at the same time. But these are only good for very, very mild cases. If you have more significant neck laxity or jowling, then you will need a more extensive surgery like a facelift or a high smut lift. So I hope this video was helpful in explaining the blepharoplasty surgery and what it can and cannot do for you. If you have any questions about blepharoplasty surgery, please leave them in the comments below and I'll be sure to answer them. And if you would like to learn more about facial rejuvenation, make sure to subscribe to my channel.